Patricia, and then I'm just gonna make you host.
Brilliant. Thank you.
Thanks, thanks, Patricia.
Thank you. Hello, everybody.
Patricia.
Is you're all going to fall asleep now after all that exercise? I joined in at the end and I thought, okay, I'll just do these wee exercises. He puts you through your paces, doesn't
Yeah.
Yeah.
he? What do I say? So I was going to talk to you about sleep hygiene, but that takes a wee bit longer, maybe. And because we just don't have the same time today, I said to Tom, maybe we would do this wee talk, and it's about equipment and how aids and equipment might help you. It's a sort well, you know what I'm like. It can take as long as it takes, but hopefully it's a slightly shorter presentation. Um, can everybody see that slide there?
Yes.
That first wee slide, and it says, "How will aids and equipment help me?" Well, my job is I'm an occupational therapist and I work in the hospice here, but I've worked in other hospitals. I've worked in the Mater Hospital and I've worked in Musgrave Park Hospital. And excuse me, one of the main things that occupational therapists do is give you advice and maybe provide you with bits and pieces of equipment. And you might know all these different bits and pieces of equipment that you can help, and you might not. I might be telling you about something that you weren't aware of. But basically, why we advise people to use different pieces of equipment is basically to enable you to stay as independent as you can for as long as possible. Using equipment is not about removing your independence or making you dependent. It's actually about helping you to stay as independent as possible. So that's why we would recommend using bits and pieces of equipment. But we'll go into a wee bit more detail about that in a minute. Just go on to the next slide here. So why might you need equipment? There's lots and lots of reasons why. You might be very fatigued, having a chronic lung disease or any kind of interstitial lung disease is going to mean that you are going to feel more fatigued than you did before you were unwell. And that level of fatigue means that you need to budget your energy. And so sometimes using a piece of equipment rather than doing something by yourself, it means you can save energy to do something that you really enjoy rather than waste energy doing something boring. So the likes of a stair lift might be something that if you've got stairs in the house and you're walking up and down the stairs and you're finding it takes a lot of energy, a stair lift is going to be something that can help you get up and down the stairs and help you save that energy then to do stuff that's maybe a wee bit more exciting or important to you. So that might be one reason. Another reason might be because you're sore. You might just have general aches and pains. You might have a history of some kind of arthritis. As we get older, we do tend to get more wear and tear on the joints, and we get sore hips, and we get sore knees, and we get sore shoulders. And for all of those reasons, it might be easier to use a wee piece of equipment to help you with everyday living activities. And I'm going to show you a few wee bits and pieces of equipment that might be useful in the kitchen and opening doors and things like that if you have particularly sore joints. Another reason why you might need equipment is if you're a wee bit unsteady. Some people find that just having a wee walking stick gives them that wee bit more confidence and helps to keep them a wee bit steady, particularly maybe if you get a wee bit lightheaded. Maybe when you're getting up to stand, if you've got a wee drop in your blood pressure or anything, it can make you a wee bit unsteady, a wee bit dizzy for that first wee minute or two. And sometimes having a wee stick or a piece of a mobility piece of equipment can help with that feeling of unsteadiness. And for the same reason, if you're feeling weak or if you've poor grip strength, if you just find the muscles, particularly in your hand, your grip's not as good, things like opening tins and buttoning clothes and opening doors, turning keys, those kind of things, turning taps sometimes. Those kind of things can become more difficult if you've got a poor grip or your strength isn't great in your hand. Talked about being dizzy or lightheaded, particularly if your blood pressure maybe drops. Sometimes the medication that we can be on can make us a wee bit more dizzy, a wee bit more prone to be a bit lightheaded. And for that reason, it might be helpful to have a wee piece of equipment. For yourselves, maybe particularly if you're short of breath, you're wanting to conserve your breath and keep your breath for activities that you really enjoy instead of maybe burning up your energy doing things that are really boring. And sometimes when we're anxious, maybe we're anxious when we go out walking. I think I've told you about my wee mother-in-law. She had a wee trip and fall when she went out the front step one day because of the ice. And she gets quite anxious now about going out. So she has a wee walking frame now that she uses. And it just gives her that wee bit more confidence. And that's what happens, sometimes if something does happen and we do injure ourselves or hurt ourselves or whatever, we do have a wee fall, it can lead to that lack of confidence. And sometimes just having that wee bit of equipment on site or having it there to hand can be helpful. You don't need to use it all the time, but sometimes having access to a piece of equipment might be helpful. And I was really interested when Tom was sharing with us about the grip, the 3D printed grip that one of your members' families, I think it was, had printed in order to take the cap off your oxygen cylinders. That sort of thing, that's the sort of thing that we would be really interested in. Those things are really useful. That's it. That's the very thing. So those are the types of things that we would be recommending that people use, particularly if you have sore joints in your hands and things like that. So that's brilliant. Brilliant demonstration there, Tom. Thanks very much. My beautiful assistant. Oh dear. You have to excuse me. I have a wee bit of a chest infection and I'm actually better than I was, but still sounding a bit croaky on it. So, and sometimes you're just not able to do the things that you want to be able to do or things that you enjoy doing. Sometimes by using something as simple as a piece of equipment, it can actually help you enjoy what you're doing. I had a young man who really enjoyed golfing and he wanted to be able to continue golf. He's a gentleman who had motor neuron disease. And if you've been listening to the news, lots of sportsmen, etc., have recently, we've heard have died from motor neuron disease. But this gentleman wanted to be able to keep playing golf. Something as simple as getting his own special golf cart on the golf course is something that helped him actually just to maintain his interest in golfing. He also had a wee stool that he was able to use when he was sitting waiting for people to take their shots while he was waiting to go. So things like that can help you just a wee bit of equipment can help you keep enjoying the activities you really like without having to stop it altogether. So if you were able to answer yes to any of those questions that we asked, any of those issues, then you might find that there are aids and equipment that might be helpful for you. And what would these be? Well, they would help to maintain or improve your independence. As I say, it's not making you dependent. It's not making you reliant on things. It's actually helping you to maintain your independence for longer. It's going to help you make tasks easier to carry out, and it's going to make things safer. Um, if you've ever tried, maybe if you use a walking stick or you use a walking aid, maybe you make yourself a cup of tea in the kitchen and you're thinking to yourself, how am I going to get this cup of tea in from the kitchen into the living room with my walking aid and without spilling the cup of tea? Well, there's a wee piece of equipment, a wee trolley that you can get that acts as both a walking frame that can help maintain your steadiness for walking, but it also has a wee tray on it to put your cup of tea on or your bits and pieces. So that can make it easier and safer to bring that cup of tea into the living room. Sometimes you just need to conserve your energy, and particularly with the likes of yourselves who are dealing with chronic long-term conditions, that energy that you have is very precious, and you want to keep that energy for things that are important. Using a wee bit of equipment can help you to save a wee bit of energy to do something that's nicer and more fun than just maybe like getting up and down to the loo or whatever. Helps to build your confidence, particularly maybe if you're finding yourself a wee bit unsteady when you walk. Just having a wee stick can help to improve that confidence. And it can help to reduce symptoms such as pain and fatigue and shortness of breath. If you're able to use a wee walking frame, for example, when you're walking, you can rest, you can stop and take a wee break easier if you've got the frame, or if you have one of those wee four-wheeled walkers that have a wee seat attached to them, they're even better because you can walk along for a wee bit, take a wee seat and rest for a while and then get up and keep walking. So you've got your seat with you when you're going, and I'll show you a wee picture of that in a minute. It's also going to help reduce the risk of falls, and we all worry about, well, I worry about falling. Don't know about yourselves, but I worry about falling because as you get older and and you're maybe a wee bit more unsteady on your feet, if you have a fall, the consequences can be so much more difficult. It's not like when we were younger. I was just hearing, my colleague was just telling me about her brother-in-law who is in his 40s, who thought that it was a good idea to have a wee go on his niece's skateboard, had a wee go on the niece's skateboard, come off the skateboard and broke his hip. And like 46-year-old man, probably thought he was only having a wee bit of a laugh, ended up with a broken hip and probably he's had to have surgery, etc. But none of us are immune to falling, particularly if we do stupid things like get on youngsters' skateboards. But we always need to be careful about the risk of falls. And it's going to help you improve your quality of life. If you're able to use something and it makes a task easier, then it's going to improve your overall quality of life. And that means your mood will be better as well. Okay. So what type of equipment, what sort of things am I talking about? What kind of things might be helpful? Now, I don't know when I said equipment, what maybe automatically comes to mind. Maybe you think of things like walking aids and like Zimmers and rollators and wheelchairs, and you can see the wee in the picture here. There's a wee man with a walking stick. There's a lady with a Zimmer. There's a man with his wee mobility scooter. There's a wee man lives in my street, and he has one of these mobility scooters, and he has it all like rainproofed. He has a big like canopy on it, so it's all rainproofed. And I don't know what he's done to this mobility scooter, but he's obviously zipped it up a bit because he flies up and down our road on this mobility. He would take you out if you got in his way. He would absolutely take you out. They're only meant to go like so many miles an hour, but I think he's obviously put an extra engine or something on his. But he flies up and down the road, and you really need to jump out of his way. So there's lots of different pieces of equipment that you can get that might be helpful. So for mobility, the likes of they range. These are sort of, I suppose, in order of how much help you're maybe going to need. So you might start off with the likes of a wee walking stick, and that's one of the old boring ones that they would give you in the hospital. An old boring stick. You can get nice sticks in garden centres and all now, and nice ones for the ladies. You can get nice ones that have wee flowers and all on them. And for men, you can get the black, what do you call it? The blackthorn, is it? You can get those nice sticks. And as long as it's got a good ferrule, see the wee bit at the end, that wee rubbery bit at the bottom? As long as your stick has got a good ferrule on it, and it's a good sturdy stick, then a lot of these wee sticks that you can pick up in different places, they're okay. It's also important that your stick's the right height for you. Because if you use a stick that's the wrong height, it can actually make you feel a wee bit more unsteady. So make sure it's the right height for you. And the right height would be sort of where your hip is and where your where your wrist comes to and where your hip is. But you'd be better asking somebody like a physio or an OT or somebody to just check the height of your stick and make sure it's the right height for you. Next thing you might need would be a Zimmer. You can see the Zimmer here. It's got 4 feet on it. A lot of the Zimmers that we would provide now actually have 2 wee wheels at the front and then the 2 feet at the back. And the reason for this is they're a wee bit easier to manage. The Zimmers that have the 4 feet, you have to kind of lift them along. Some people find that difficult. The ones with the wee wheels, if you've got a flat enough carpet or if you've got like a wooden floor or laminate floor or vinyl or oilcloth, as my granny used to call it, then these sort of move along easier. You don't have to lift it. So you can get, as I say, you can get the Zimmer with the feet or you can get a Zimmer with 2 wee wheels on it at the front. Next one along, the funny shaped thing, that's called a Delta rollator. And you might have seen these and you might have one yourself. And a Delta rollator, it's called a Delta rollator because Delta is a letter of the Greek alphabet and it's like a triangle shape. So that's why the rollator is like a 3-wheeler, but it's like the shape of a triangle. So that's why it's called a Delta rollator. And a lot of these Delta rollators will come with a wee bag. And I think the wee bags are brilliant because you can stick all your puck in your wee bag. And if you have a wee oxygen cylinder or anything that you maybe need to take with you, you can stick it in your wee bag if you're only going a short distance. The next one along there is the 4-wheeled walker. That's the one I was telling you about that has a wee seat attached. I think these are great jobs if you're going out, particularly maybe if you're wanting to go to a shopping centre. Shopping centres now tend to be really wide, expansive places. And for you to get from one shop to the other, you've quite a bit of walking to do. And you might want to go to Boots, and Boots is down one end, and you might want to go to Primark, and Primark's away the other end. Well, this walking aid will not only will it help you to feel more steady on your feet, but it's got the wee seat built in so that if you do get tired, you can stop, you can put the brakes on, you can have a wee seat, and then you can get up and go when you feel like it again. And also you can get ones that have, you see the way there's like a wee bag in the bottom of that. You can get ones with a wee bag so you can put your truck in it as well. And you can get attachments for your oxygen cylinders and stuff like that too. Next one along then is a wheelchair. And you can see there's 2 pictures of wheelchairs here. The first picture of the wheelchair has all small wheels. So that's called an attendant propelled wheelchair. And obviously the meaning is in the title. You need somebody to push you in this kind of a wheelchair. And you'd maybe use that. See if you go to the likes of the shopping centres. If you speak to any of the security guards and ask them if you felt you could benefit from a wee wheelchair just for a half an hour while going around a shopping centre, if you speak to the security guard, they will normally have wheelchairs that they can lend you so you can get round the shopping centre. And there tend to be ones like that wee one there. Some places do have Motability attached to them, and there's special places. I think Forest Side used to have a place attached where you could go in and you could borrow different wheelchairs and that. But most of the shopping centres would have a couple sitting about that you would be able to borrow. And then the last picture there is a picture of a chair. This would be a self-propelled wheelchair. And again, the clue's in the title. The bigger wheels mean that, excuse me, you would be able to propel yourself around in this wheelchair. But the other good thing about this wheelchair, and you see that attachment for the oxygen, you can put that on the other wee wheelchair as well. So it's that wee attachment that you can put your oxygen cylinder in. You can get that for that other chair too. There's all sorts of different attachments that you can get for your oxygen, depending on the size of your cylinder and what you need. Excuse me while I take a wee drink here.
No, bye.
Now, anybody want to ask any questions? Is all right? Go on to the next bit. So, what about things to help you get washed and dressed? There's a couple of things here. I hope you can make them out. The one up in the corner here, the wee pale blue sponge on a big stick. You can buy these in Home Bargains, and you can buy them in different places. And basically, it is what it is. It's a long-handled sponge. But for some of us who maybe have trouble getting round the back of us done, or if you're in the shower and you have a shower seat and you're wanting to get the toes done or you're wanting to get your feet washed, this is a great wee thing that you can use without having to bend away over. You can wash around your feet and you can give your feet a good scrub without having to bend forward, because sometimes that bending forward, notice that your wee physio friend, when he was telling you about bending forward, you're actually restricting the amount of air that you're able to get into your lungs when you move forward. So if you try and limit the number of times you're doing that when you're having a bath or you're having a shower and getting washed, you could use that wee thing and it would make it easier for you. This red thing, does anybody know what it is? Anybody want to shout out, tell me what they think it is?
Shoehorn.
It is, well done. A shoehorn's one of those things that my granny would have had a shoehorn, but not so much nowadays. But this is a long-handled shoehorn, so it's specially elongated. And again, it's one of those things that, I mean, they're making shoes now that you don't have to bend down to put your feet in, because they realize that people struggle to get their shoes on. But not all of us maybe can afford the fancy shoes that you don't have to bend down to get your feet into. So this is just something you literally just slide this into the back of you slide it into the back of the shoe, and then you literally sort of slide your foot down. See the way it's like wide. You slide your foot down that wee red bit into the shoe, and it means you're not having to foot her with the back. No, the way you foot her with the back of the shoe to make sure it's on you right. This is gonna help. Now, this wee contraption here, the wee wooden thing with the wire bits at the end. Anybody like to hazard a guess what that is? Any ideas? I'm gonna have to tell you.
For buttons,
Yes, well done. Who said that? Big gold
Shirley.
star. Well done.
I,
Yes.
I haven't, I haven't got one, but I think I'm getting to the stage where I might need one.
Do you know what? They are brilliant. They are brilliant. The bit that looks like a folded over paper clip, that's for your button, and you literally you push that through the hole. You push the wire bit through the hole of whatever it is you're buttoning. You wrap the wiry bit round, and then you pull it through. And it saves you having to footer and footer with buttons. The other wee bit on the other end, the wee hook, that's for your zip. So you hook, do you know the way your zip's got a wee opening at the end, a wee hole at the end? You hook that through the zip, and it means you've got more of a grip to pull the zip up. Instead, sometimes if your fingers get very numb or you're maybe really cold even, that's going to help you pull your zip up. So that's a really handy wee piece of equipment that's very, very useful for all sorts of reasons. That's very useful. The next one down there is a comb with a big long handle on it, and that's easy. That's just a long handled comb. Some of us can't maybe reach up and get our hands up above our heads, so that's maybe a wee bit easier. You can do it from here. And then I don't know if you can make out what this one is at the end. It's not the greatest picture, but it's like a blue, like a half cylinder with straps attached to it. Does anybody want to hazard a guess what they think that might be for helping with?
Is that one for socks?
Yes, you're brilliant. I'm going to bring you with me when I'm doing this talk other places. Yes, exactly. That's exactly what it is. Socks or stockings and things like that. You can get a double one for tights, and it works in the same principle. But yes, it's a sock aid. So now you need to wear socks. It's not the tight ones. Do you know, I keep telling you, as I buy everything in Marks and Spencer's. Marks and Spencer's do a sumptuously soft range of socks, and their sumptuously soft range of socks don't have that very elasticated bit at the top. You know, the way sometimes that would dig into you. But that also means that they fit nicely on these sock aids, because the ones with a lot of elastic around the top, they are harder to get on these. So you need the nice softer ones. You can get ones nowadays that are more sort of they're wider at the top actually, so that they're not, especially maybe if your feet are a wee bit swollen, you're better trying to avoid the socks that are very, very tight around the top. All right. So well done, Shirley. Is that you, Shirley? You get the top prize today. Big gold star to Shirley. That's
I
great.
those socks that you're talking about, I have those. I can't remember the name of it.
Yes.
But they're absolutely brilliant.
I
Yeah,
yes,
I
because
highly recommend the socks.
I would use those socks. I don't like anything too tight, but that it's not because I'm autistic, so I don't like anything that's too tight. I pull all the labels off all my jumpers. I have nothing with a label on it. I have lots of holes in the back of jumpers and t-shirts and all the rest of it, but I can't bear anything too tight. So that's why I like those socks as well, Shirley. You can get them, and there's a wee shop in Portrush that is not the White House. It's on down a wee bit from the White House, and it looks like nothing, but it sells lots of like more old-fashioned-y looking stuff. They do those socks. If you're ever looking them, Shirley, they have them in there.
Wise Buys used to keep them, and the Edinburgh Woolen Mill, but Wise Buys is gone
Yeah.
now. So
Yeah,
I
Wise Guys is shut down now, hasn't it?
yeah, uh,
It's very
but
sad. Oh,
highly
you know.
recommend those socks definitely.
Uh, there we go. Well done, Shirley. You're my star pupil. Other aids and things that you can get would be things maybe for the bathroom, and maybe you have some of these. Maybe you recognize what these things are. So the first wee one there, the one with the blue on it, that's called a perching stool. And sometimes we would recommend that you would use a wee perching stool. Ladies, if you're doing your hair or you're doing your makeup, or even if you're in the kitchen and you're wanting to peel the potatoes or um, do a wee bit of ironing, something like that, you might find a perching stool is something that's easy to use. It keeps you at a good height, but it means you're actually able to take the weight off. So you're able to be at a good height to see into a mirror or to be at the sink or to be doing whatever it is you're doing. It's adjustable. You can see the wee feet at the bottom there. You can adjust the height, but it gives you a wee bit of back support with the wee cushion at the back. But it means you can, as I say, you can sit and do your hair or sit and do your makeup at the mirror at a good height without having to stand. Because if you're able to sit rather than stand, that would make me happy. I think you should always take the weight off. And if you can sit, just sit. I sit everywhere. I'll tell you a laugh. I've probably told you this before. The white curly hair has come in very handy for me when I've been away. And we were in Rome about a year ago now, I would say it was. And we were on the underground. The underground was absolutely packed. And I kept thinking, oh, I need a seat. I need a seat. Well, every single underground that we went on in Rome, all these lovely young men would get up from their seats and give me their seat. And I says to my husband, they don't realize I'm not that old. It's the white curly hair. They all think I'm a wee old lady. So they were getting up and giving me their seats. And I was going, thanks very much, son. I'll take that. No problem at all. But Jessie came in the white curly hair comes in handy sometimes. Apart from when the man said, Move It Grandma in America. And my son literally had to hold me back because I was going to lump him. This fella called me, Grandma, Grandma, I'm Grandma, you. That was in America. And probably like you wouldn't be wanting to lump anybody in America. You could end up in Guantanamo Bay or something like that if you did that in America. Right, got your perching still. The next one along, the white one with the holes at the back, that's a shower chair. Now you can get shower chairs that have wheels on them, or you can get a shower chair like this. This one would just sit in your shower. Now, because of the width of it, it's not every shower that kind of shower stool is going to fit. So that's why if you look along to the next picture, there's this wee chair here which actually attaches to your wall and it can flip up out of the road. So that if there's somebody in your house doesn't need a shower chair, you can flip that up out of the road and they can use the shower normally and then you can flip it down. Now you need an external wall. You can't put, obviously you can't put that equipment on a stud wall. You need a weight bearing wall to put that wee stool on, but that's a very handy wee thing that we flip up shower stool. The wee frame round the toilet down in the corner here, that wee frame just gives you a wee bit of something to hold on to when you're maybe getting up and off the toilet. The next one along is a raise for your toilet. Sometimes, when the old knees maybe start to go, getting down onto the toilet and getting back up again, it's that difference in height. So if we can make the toilet a wee bit higher, it makes it easier to get on and off. So that's what that wee raise is for. And then if you can see that picture, the next one in the bath, there's like a wee stool inside the bath. And that's a handy wee thing. Again, if you have difficulty getting in and out of the bath, this is like a halfway. You're able to get into the bath and sit in this wee stool. If you're already sort of half out of the bath, if you know what I mean. So you're not having to get right up from the bottom of the bath to get yourself up. You can get yourself down into the water if you want, and then do it in stages. Get up onto the seat and then out. And sometimes you can get a wee board to put across the bath as well, which can help you getting in and out as well. But these are all different wee things that might be helpful for you. I'll tell you at the end how you would access all these different pieces of equipment. So the next slide here is about things that might be helpful for eating and drinking. We're thinking maybe particularly about people who would have sore hands and poor grip, or maybe sometimes people would have maybe a wee tremor. Some of us maybe get like what's called an intention tremor. And whenever you go to lift something or you go to do something, your hand maybe starts to shake a wee bit. That's called an intention tremor. And sometimes these bits and pieces of equipment can help with that. So the cutlery that you can see here is all built up, and so it's easier to grip. The cutlery that's got the white handles, you can see the way it's curved. It means you're not having to do as much twisting and turning to get the food up to your mouth. I'd need one of those. My husband tells me whenever we go out, I would need a bib because you can always tell what I've had for my tea because I have it half around me. I always
Yeah.
fill the food half around me. If I'd spoon like that, it might be easier. This wee plastic thing that is round this edge of the plate there, that's called a plate guard. Sometimes if you're eating and you're maybe only able to use one hand, your food can go skiting off the side of the plate. Well, basically all that is just, it's a wee ridge. It stops your food from skiting off and makes it easier for you to scoop the food up. You can also get plates that stay warm. You can, if it takes you a while to eat your dinner and you find that by the time you get to the middle of your dinner, it's half cold, you can get wee plates that have like hot water in a wee reservoir underneath that can keep the food warm for longer. Just takes you a wee bit longer to eat your dinner. And then there's different types of cups and things that you can use. The two-handled cup might be for somebody that maybe hasn't got the same strength in their hands. And maybe if you're If you're spending a lot of time lying down or, you're not sitting up as much, the wee sippy cup can be handy for that. And then if you see this picture, the picture of the tray is actually to show you I don't know if you've heard of Dyson matting, but this kind of matting is it's like sticky. You get it on a roll and you can cut it to size. But the great thing about it is if you are carrying a tray or anything like that, or you're sitting, if you have those wee trays that you have on your lap, maybe when you're sitting watching the TV and you want to have your cup of tea and in front of the TV, this type of matting will mean that your cup won't slip and your plate won't slip. It's very, very handy. It's called Dyson. Dyson is the people who make it, but there's all sorts of different types. Basically, it's like a non-slip mat, and you can cut it to size and use it for all sorts of things. It's very, very handy. Different kitchen aids. So we talked about the perching stool. There's the wee trolley I was telling you about. I broke my ankle one time, and I can remember going into the kitchen and making myself a cup of coffee. And then I stood in the kitchen and I cried because I couldn't figure out how to bring the cup of coffee back into the living room because I couldn't walk without my crutches. And if I'd had a wee trolley, I would have been able to carry my coffee in my trolley. But I would have had my wee bit of Dyson on my trolley to make sure that my cup stayed in place. This white thing here is like a cutting board. Do you know if you find things skite over the place whenever you're trying to cut things? It's got like wee prongs on it. So you can set, for example, if it's your potato, you could set your potato on that. You could peel one side, lift it out, turn it over and peel the other side. Saves the potatoes skiting all over the place. And these are different things for opening jars. There's lots and lots. So you can get, again, some of these things you can get in the likes of Home Bargains. And definitely you will get them in Boots. Do an online range of different wee bits and pieces of equipment. You'll be able to get them in those kind of places. But they're all very handy, particularly like this one for opening the tins, jars. I mean, I find it, I've pains in my fingers. I find opening those kind of ring pull tins very difficult. This is a wee contraption to help you with that. And then there's other aids and things that might be able to help you at home. So you can see the bed here.
Brought the Dams and Jam.
Who's having Dams and Jam? Dams and Jam's my favourite. Who's talking about Dams and Jam? I used to get Dams and Jam, Ballyleeson Dams and Jam. You can't get it anymore. If anybody can tell me where to get good Dams and Jam.
Banbridge.
Where?
Banbridge.
Banbridge.
In the vegetable shop.
Right. My granny used to make Dams and Jam, and it's the only jam I'll eat. And you can't get it everywhere. It's not everywhere does Dams and Jam. Anyway, this bed, you can see there's like a wee bar at the side of it. If you've got an ordinary bed, but you're maybe having a wee bit of trouble getting up and out of bed, but you don't want to go the full scale of getting a hospital bed, you can get this wee piece of equipment which is called a bed lever. You need to have a divan bed for it to work properly. It's sort of, you can see it sits under the bed frame, and then there's a bit goes under the mattress, and then that means you can hold on to this sort of handly bit, and that means you can get yourself up out of bed, or even sometimes, sometimes it's hard to get maneuvered in bed. You can use that wee bar to help yourself get maneuvered in bed as well. Next one along that's a commode, that brown seat. And I know sometimes we don't like talking about these sorts of things, but see, sometimes if your main bathroom's maybe up the stairs and you don't have a toilet downstairs, and you're maybe going up and down the stairs to the toilet a couple of times a day, that takes an awful lot of energy. Whereas if you have a wee commode, it means you're only having to maybe go up and down the stairs to come down in the morning and go up at night. And you could ask somebody to help to empty. My mother-in-law has one, and we would take it in turns who goes and empties her wee commode and gives it a wee rinse through. If you don't like the look of it, which I know lots of ladies and all don't like, you can throw over it, get a nice fleecy throw and a nice cushion and throw it over the top, and then it looks like a lovely wee chair. Looks like a wee extra chair in your house. But you can disguise these things. But it's very, very handy if you don't have a downstairs toilet and maybe you're caught short. The wee bit of equipment there is a wee grabby hand thing. If you drop something and it's not too heavy, you can pick it up with that wee grabber. If you're having trouble on the stairs, having a stair rail is really, really important. And sometimes having a second stair rail can be really useful. If you've got one rail on one side, and you've room to put a rail on the other side, that can be really helpful because it just makes you nice and steady because you have the two hands on both sides. But if things get more difficult and you're finding the stairs really quite difficult, then you might think about something like a stair lift. And that's what that there is in the middle there. That's a wee stair lift. And then the picture at the end here is a young girl who doesn't need to be in this seat. Why do they put these people in these bits of equipment that there's no way on this earth does that girl need that chair? But anyway, she's sitting in this chair. This is called a riser recliner, and it does exactly what it says. It pulls you up to a certain position so that you're not having to push up so far from the seat, but it will also recline. And these are great jobs. And sometimes your OT can provide you with one of those. So why not have a wee go and see if maybe you think if there's any of those bits and pieces of equipment you can try. Because if you do use these bits and pieces of equipment, it can make tasks easier and safer. It can help to maintain or even improve your independence. It can help you to manage symptoms like pain, shortness of breath, and fatigue. It can allow you to get out and about and go for longer distances for a longer time. It can encourage your engagement in activities, your hobbies, and your interests, and get you out to different events. It will help you to conserve your energy. It will improve your confidence, reduce anxiety, reduce your risk of falls, and improve your quality of life. So now the burning question, you've told me all this stuff, Trish, how do I get this now? Where do I go to get this? Well, for the bigger pieces of equipment, for the things like the bath aids, the second stair rail, the stair lift, the riser recliner, those kind of things, you would be asking to be referred to your occupational therapist for these sorts of things. So if you went to the GP and said, I need a refer, or even your district nurse, if you have a district nurse who comes in, just say, I think I could benefit from a wee piece of equipment. Could you refer me to the community OT? She's your girl or your fella who will sort you out. You can be referred to your community physiotherapist for walking aids. Just tell you, in some regions, it's actually the OT who will also provide you with a walking aid. So if you're referred to the OT, she'll hopefully be able to sort you out with your bathing aid and your walking stick and whatever. So, but it depends where you live. It depends on your area. If you need something like a commode or a hospital bed or maybe a special cushion if you're having problems with your skin, the district nurse will provide those bits of equipment. And wheelchairs, there is a wheelchair service in Northern Ireland. It's based in Musgrave Park Hospital, but the wheelchair service in Musgrave Park Hospital is for people who require a wheelchair 24/7, basically. So any other wheelchair basically is loaned, and that's through the British Red Cross. And you can contact them, and they will loan you a chair for a length of time at no charge. I think sometimes they do ask for a wee donation, but you can borrow wheelchairs from Red Cross, or you can borrow them, as I say, from the likes of shopping centres. Smaller aids you can purchase from a variety of sources. You can go onto Amazon and you can find anything on Amazon. And Argus have a health and wellness section. And lots of local companies have showrooms with aids and equipment on display. And they can order stuff in for you specifically. If you're going to privately purchase aids or equipment, there's things maybe you need to think about. Always go to a reputable company. So if it's any kind of money you're wanting to be going to the likes of Boots or even Argus or some of the companies that would have these bits of equipment on display, so that you can use them first, try before you buy, and maybe get your money back if it's not useful. So as I say, if possible, try and look at the equipment in a showroom and try it first before you buy it. Discuss this with your family and professionals. Don't be rushing in and spending a whole lot of money on something before you discuss it with your family or other professionals. If you're doing an online purchase, just be careful. Check the reviews and just check the terms and conditions and those sorts of things. Please don't be handing a whole lot of money over for something online if you haven't done a wee bit of homework about the company that's providing it. And you might need to consider if your needs change over time. Is the equipment that you've selected most appropriate? So you might buy something that'll do you for now, but if things maybe change, are you going to need something else? So maybe thinking about, what you spend on bits of equipment. And the other thing is, if it's a larger piece of equipment, something like a stair lift, there are some companies who will rent you a stair lift. So they will charge you a fee initially to put the equipment in, and then you basically rent it off them for a period of time. And there's other bits and pieces of equipment. I think if you ask any of the big companies, any of the big reputable companies, if there's a piece of quite expensive equipment, if you ask if the possibility that it can be rented, might have a wee conversation with you about that. So it's all about quality of life. It's all about maintaining our independence. And that is your lot for the day. That's me done. Is that a record, Tom? Where do I say? I'm going to stop sharing. There we go. There we go. Now, anybody have any questions?
Not a question, Patricia, but just while if anybody's interested, these are the socks I have. They're called Gentle Grip.
Brilliant. Yes,
I bought those a good wee while ago, but I had them in the drawer still in the packet, so that was how I was able to. But
they're
you probably
great.
get them online now too. But they're soft top. They're lovely.
They're easier to
All I wear.
get on, and they're also great if you do happen to have a wee bit of swelling in your feet. They're great because the ordinary socks will create that ridge. That'll be quite sore. I'm gonna have to run, Tom, if that's okay. I have another meeting. It's just blipped up at me here, so I'm gonna have to go. But thank you very much for having me. Thank you, Shirley, for being my star pupil today. And listen, thanks very much, and I'll see you soon.
Thank you very much, Patricia. I
Thank
really
you.
appreciate it. Thank you.
Bye-bye.
Thanks very much.
Bye, everybody. I have to run too. Bye-bye.
Yeah, I've got you on there. Yeah. Some good advice there from Patricia, as usual. If you haven't got your OT out for some of that stuff, we've talked about it before. Remember to get the OT out, and if you need any of that equipment, I think some of the smaller equipment you've got to buy yourself nowadays, but all the bigger stuff you should be able to get. I'm talking about smaller stuff like helping hands. They're like the little pickers and things like that. I think you have to buy them yourself though.
Therapy. Okay.
Folks, I have to go too here.
Okay, folks. Okay, no
Hope
worries.
to see some of you on Friday up at Asda.
Yeah, yeah. Asda, we have a collection day up in Asda in Antrim. If anyone's around, be nice to see you. Okay,
Right,
so
bye,
folks,
folks. Bye.
we'll leave it at that as well, because I've got another meeting coming up in another 10, 15 minutes. So I
Okay.
just want to have a wee break, and sure, I'll talk to you soon. Okay.
Okay.
All the
Thanks
best.
again.
Don't forget exercise
Bye-bye.
class again next week.
Okay. Right.
All right. Thanks,
Bye
now.
bye. Yeah. Bye
Enjoy
bye.
your week, everyone. Bye bye. Bye.
Bye.